Hi everyone, my section focuses on the current global health concern of Ebola virus disease or EVD. As reported by BBC News 2024, Uganda's Ministry of Health confirmed 50-50 EVD cases with 19 fatalities before declaring the outbreak controlled. This announcement was followed by the WHO's EVD health emergency of international concern classification, with no remark thus indicating public health concern. Ebola is a viral hemorrhagic fever that results from Ebola virus. Transmission of the virus occurs via direct and intimate contact with bodily fluids of both living and deceased infected individuals, as well as contact with the disease-contaminated objects and corpse. The disease mortality rate is extraordinarily high, with nearly 90% of cases in contaminated outbreaks ending in death. The BBC article, while highlighting the deficiencies of healthcare systems, the continuing stigma that delays help-seeking and EVD viruses cause deaths, illustrates the continent of Africa remains at the epicenter of EVD, and the rest of the world, with its weak and poorly constructed healthcare system, remains at risk. How Ebola is transmitted and managed is also influenced by different cultural and social factors. Kusena 2014 studied caregiving mortality in frontier Tanzanian communities. Familial homes caregiving continues without protective equipment because it's considered a moral obligation. One relative described home caregiving as, "If I die from touching him, let me die." Many families continue to care for sick relatives and do not use protective equipment because they see it as a loving act and a duty. Insubstantial communication and intervention by healthcare officials, as pointed out by Kusena 2017, is primarily because they fail to account for cultural factors at hand. Anthropologists and other types of health facilitators should communicate to communities with culture, humility, and openness, and not judgment. From a nursing perspective, Von Strauss 2017 showed that while many nurses felt physically ready to face Ebola, over half lacked mental health support. Some described going from heroes to pariahs after returning home, revealing the emotional toll of outbreak work. This shows the effective response isn't only about clinical skills, it requires resilience, leadership, and psychological care. Ebola connects directly to PPM principles, autonomy, responsibility, and relational care. Nurses must balance compassion with safety and practice with empathy. Preparedness isn't just about equipment, it's about education, ethics, and humanity. This issue reminds us that nursing is not only a profession, but a global responsibility.
To support the BBC article, we reviewed 2 peer-reviewed articles that provide a deeper insight into the issues discussed in the article. The BBC article talks about how nurses and other healthcare workers are again on the front lines as Ebola reemerges in Guinea, and how preparedness is crucial to stop the spread. The first reviewed article by Von Strauss and his colleagues support this point by showing what frontline nurses actually experienced during the 2014 to 2015 Ebola outbreak in Sierra Leone. The researchers surveyed 44 nurses from 15 different countries and found that many felt physically ready but lacked the hands-on clinical and PPE training that was specific to Ebola. They also reported intense psychological stress, fatigue, and even stigma when they returned home. This research backs up the BBC article because it provides evidence from the previous outbreak showing that without proper preparation and emotional support, healthcare workers face major risks that weaken the outbreak control. The BBC article also highlights how fear, misinformation, and lack of public trust are making it harder to control the spread of new Ebola cases. The second peer-reviewed article supports this by showing how community mistrust slowed Ebola response efforts in Uganda. Many residents avoided treatment centers and hid sick relatives because they didn't trust the government officials. This connects to the BBC article by giving research-based evidence that community engagement and culturally respectful communication are essential for outbreak success. Both of these articles provide evidence that support the BBC's warning that controlling Ebola depends on 2 things: prepared, supported nurses and trusting communities.
Philosophical approaches used in these 2 articles. In the first article, the study uses a phenomenological approach which focuses on the nurses' perspectives and their experiences working in life-threatening conditions. It captures the human side of global health, showing how these nurses make sense of fear, exhaustion, and compassion in the middle of crisis. The article also uses a critical social theory approach, which looks at how larger global systems shape the nurses' experiences. It critiques how organizations were often unprepared, how mental health support was limited, and how there were inequalities between international and local staff. These two frameworks enhance the discussion because the phenomenological approach gives voice to the emotions and lived experiences of nurses, while the critical social theory exposes the systemic failures and power imbalances that affected them. Together, they show that health crises aren't just biological, but they're also social and ethical. However, these frameworks also have limits. The article doesn't offer clear policy solutions on how to fix these structural issues. It also leaves out the voices of local African nurses who face the same dangers but with fewer protection, including their experiences as well as the perspectives of mental health experts and policy leaders would have helped connect the nurse's story to a larger question about long-term trauma and organization accountability. The second article focuses on how cultural practices in the Tanzanian communities influence Ebola transmission. This phenomenological approach explores how people experience illness and death within this culture. It demonstrates the emotional meaning behind caregiving and mourning practices, for example, like touching, washing, or hugging the dead. The study also applies a social justice approach, which advocates for health education that respects cultural tradition instead of just ignoring them. It suggests that the global health systems need to adapt Ebola prevention messages to local communities rather than forcing Western medical standards. These approaches enhance the discussion because the phenomenological lens helps us see how cultural beliefs shape caregiving, while the social justice perspective encourages inclusion and respect within the healthcare systems. But there are also limits as the article overlooks the structural and political issues that may also affect Ebola risk. It also misses key voices that could have deepened this study, such as traditional leaders, local nurses, or government officials who have direct influence on community health practices. Overall, both articles show how the philosophical approaches help us move beyond numbers and see the human, cultural, and ethical sides of global health challenges like Ebola.
Why culture matters in Ebola outbreaks. Before talking about specific practices, it is important to understand why culture matters in Ebola outbreaks. In the DRC, traditions and daily behaviors shape how people respond to illness and public health measures. If health teams don't consider these cultural realities, communities may resist or misunderstand interventions, which can make outbreaks harder to control. Some specific key cultural practices affecting transmission of Ebola in the DRC are patient care. Sick people are often cared for at home with close physical contact and without proper PPE. Women are at a higher risk because they are typically the primary caregivers. Some people or most people rely on fatalistic or faith-based beliefs. Death and mourning. Physical contact with the deceased is part of important spiritual rituals like bathing the body, dressing the body before burial, and changing these customs can feel disrespectful. Communal living. Shared bowls, close sleeping arrangements, and large gatherings increase the spread of Ebola, and physical greetings like handshakes and hugs are deeply engraved into their everyday life. These practices are not careless, they're acts of love, respect, and community, but during an Ebola outbreak, what's normally safe becomes high risk, which is why understanding the cultural context is so important. Cultural gaps and opportunities. Public health response work best when they partner with communities, not imposed from the outside. Involving local leaders in adapting rituals builds trust and can save lives. When cultural beliefs or traditions are ignored, people may resist health measures or turn to unsafe hidden practices. But when local knowledge is respected, communities become active partners in response efforts. This not only improves cooperation, but makes interventions more effective and sustainable.
Von Strauss describes Ebola as a highly lethal and contagious disease where healthcare workers have been infected while caring for patients. Nursing implications related to this article could include controlling the infection and recognizing signs of the disease. According to Kusina, Ebola can transmit from human to human through bodily fluids, contaminated objects, and handling corpses. Nurses would need to use personal protective equipment or PPE and proper hand hygiene to protect themselves and others from the contamination and spread of the disease. Isolation procedures might also be put in place to further contain the disease. Early detection is key in preventing the spread. As said by Kusina, countermeasures for timely detection are necessary preparations for the dangers of Ebola. As a result, nurses would use the Clinical Judgment Module, or CJM, to assess patients and give them the treatment they need as early as they can identify any signs of Ebola, such as high fever or repeated vomiting, as mentioned in Chothia's article. Thank you for listening to our presentation.